Hello, my name is Lise Johns, and this presentation will provide you with an overview of research that was undertaken on the topic of exploring psychosocial care provision for terminally ill clients in rural Australian communities, with a particular focus on the role of social work. So up until 2014, I worked as a general social worker in a small 22-bed rural hospital, and it was here that I worked quite closely with palliative care patients who came into hospital for end-of-life care. And my main role was to address all psychosocial concerns for patients and their families. And it was within this context that the idea for a PhD topic was born. So in brief, there were two aims to this research. First, to explore how psychosocial care provision is addressed in rural and remote communities from the perspective of healthcare workers and from palliative clients themselves. It was important to hear their voices. And the second aim was to understand the social work role within a rural and remote context. So as mentioned, this research became my PhD topic, and I was fortunate enough to have two experienced social workers and researchers to supervise the project. So Professor Donna McAuliffe and Emeritus Professor Leslie Chenoweth. And the three of us worked diligently for almost 4 years to complete this project. And when it came to writing and publishing, Dr. Pat Dorset came on board and she assisted with the publication. So after ethical clearance was attained, extensive planning was undertaken. The data was collected by means of qualitative interviews, and because the participants lived in rural and remote areas of Queensland, a 5-week road trip was then undertaken in a camper van to collect the data. 7,500 kilometres was travelled in total, with 38 participants interviewed in 24 rural and remote communities. So the findings revealed an ad hoc, inconsistent situation. In some communities, psychosocial care was undertaken well, whereas in other communities, this type of care was not addressed particularly well. And there are a number of reasons for this which are explored in the article. But in brief, factors such as staff availability, their skill level, their interest and confidence impact. The burden of travel also played a role, along with concerns about accessing the palliative care program funding. And finally, the findings revealed a disparity between clients' concerns versus the workers' focus. I think it's really important to state that many rural and remote healthcare workers do an amazing job with the limited resources that they have, and they often assume roles that other professions would normally undertake in metropolitan areas. But this study does make multiple recommendations regarding education and training, all of which are addressed within the article. There is a strong recommendation for a national standards document to be written for application for rural generalist social workers and not just for social workers working in specialist palliative care teams. And this document could serve as a framework to provide guidance regarding quality psychosocial care. And the document should therefore be endorsed by the Australian Association of Social Workers. Palliative care in general in Queensland has no statewide plan, and this urgently needs to be addressed. And finally, the study outlines the desperate need for resources to be available for terminally ill clients in rural and remote areas. Some points for further research would be the importance of cohesive interprofessional teams in regional, remote and rural context, even if that team is only 3 people and that they may not all work in the same service. Another area would be the value of social work input in rural and remote contexts. And then finally, research on how bereavement care and how issues such as prolonged grief disorder is assessed for and addressed within this context. So just to finish, advocating for vulnerable populations is definitely a must for all health professionals, and a lone voice is simply not enough.